what is the incentive payment that a QP can expect? So we know that they can earn the Advanced APM incentive. What is that? What does that look like for 2024?
Great question, Brigid. I'll start with a straight out answer, and then I'll explain for everyone else the confusing terms that I'll introduce. For the 2023 performance year, the APM incentive is 3.5%. Now, after that's paid out, these incentives will no longer be paid as a lump sum. The lump sum incentive payment is being replaced by a higher conversion factor paid to QPs, that is qualified participants, on the physician fee schedule. Rather than a lump sum, QPs will enjoy slightly higher payments on every Medicare reimbursement check. Now, there's lots of room for confusion here as we consider performance year, base year, and payment year. It's really confusing, and I've had to carefully dissect the regulations to be sure I have it right. And I'm still not absolutely sure. So if you find a credible reference that tells you something different, I'd be grateful if you'd share it. Any of you listening in, you remember that we can be smarter together. I believe that. Now, the definitive resource for this is the Electronic Code of Federal Regulations at www.ecfr.gov. Now, simply searching for 414.1450 should get you to the relevant passages, whether you're in the electronic code website using their search tool or whether you're going directly from your favorite search engine. Now, 2023 as a performance year set up qualified participants to get a 3.5% incentive that would be paid in the 2025 payment year. Now, this year, 2024, between the performance and payment years is called the base year, in which the amount paid by Medicare to the qualified professional for 2023 will be determined. Next year, 2025, again, is the payment year in which 3.5% of your 2024 Medicare payments will be paid in a lump sum to 2023 qualified participants. Now, our last glimpse of the 3.5% APM incentive will be when it's paid in 2025. Then it's over. Now, I know I've lost many of you, so I'm going to say it again in a different way. There's a 3-year cycle to the APM incentive. There's a performance year in which you become or not a qualified participant or a QP. The next year, the second year of the cycle, is the base year in which Medicare payments are totaled per QP. And the final year, the third year, is the payment year in which you are paid the lump sum calculated by multiplying the base year payments times the performance year incentive earned.
Let me make sure I understand this. So in 2023, if I qualify as a QP, that is my performance year. 2024 is my base year. And during this time, CMS is keeping track of how much Medicare Part B dollars I'm paid. In 2025, I will get my 3.5% times my Medicare payments in 2024 awarded to me in a lump sum in 2025. Is that right?
Absolutely correct. You get an A and can go to the head of the class and get a job at Mingle Health. All right, now, with that 3-year cycle of APM incentives defined and understood by all now, as evidenced by Brigid, let's examine the history and the future of APM incentives. The 2017 through 2022 performance years defined who would earn a 5% lump sum incentive for being a QP. In each case, the next year as base years would define the Medicare payments on which the 5% would be paid. In the final year, the third year called the payment year. The last 5% APM incentive payment will or has been paid in the 2024 payment year. Now, we're doing this recording in 2024, so right now, qualified participants are waiting for the lump sum delivery of that last 5% APM incentive payment. This 3.5% lump sum payment earned in 2023 and to be paid out in 2025 is really a last minute addition by Medicare. They're in a transition from the 5% lump sum payment to a different method of incenting qualified participant status in Medicare provider population. And then they realized that the payment windows were different, and they had to add a second year, so you wouldn't have to go a year without incentive. So thus the 3.5 incentive payment was born that will be paid out in 2025. And then we moved to a different methodology. For participants who earn QP status in this 2024 performance year, their status will be confirmed or finalized in the 2025 base year. But in the 2026 payment year, instead of getting a lump sum incentive payment, your Medicare payments will be calculated from the physician fee schedule using a higher conversion rate than your non-QP peers.
So, what I think that means is that starting for the program year 2024, the payments that a QP receives in 2026 will not be coming in a lump sum incentive. It will be associated with the Medicare billing that happens in 2026. Is that right?
Yes, generally, Brigid. Specifically, it's going to affect the Medicare payments. For those of you who are familiar with the physician fee schedule, um, the fee Medicare pays is based on a relative value scale, and those are relatively stable as yearly a single conversion factor that's applied to all of those total relative value units is created that sets the amount that you're going to be paid with some geographic modifications. Um, so uh, there are some automatic updates to that conversion factor, and Medicare intends, or they've stated the intention, starting with a 2026 payment year, that they will apply a higher conversion factor to QP payments than to everyone else's. And they'll continue to get a favorable payment year after year after that. Now, understanding that, I'm left perhaps with more questions than answers. Medicare says that the routine rise in conversion factor is 0.5% annually, and that henceforth qualified professionals will get a 0.75, so half again higher than their peers. But looking back, it's not reliable that the conversion factor goes up 0.5% annually. There's a lot of other adjustments based on all kinds of legislation. In fact, from 23 to 24, the conversion factor actually went down. And then again in 2024, as of April 1st, it went up again for the rest of the year, not the whole way back to where it was in 2023, but it's up higher. And there's a lot of other one-time or repetitive adjustments to the conversion factor that occur in legislation. I believe that sequestration, which occurred, when was that? 20 years ago, is still applies. So the question is, how is this going to be administered? Are they going to start publishing two conversion factors in the physician fee schedule? It's not published that way yet. Or will there be a standard multiplier applied by fiscal intermediaries when payments are made? So for all QPs, multiply by X. Completely unknown. And will that differential compound annually, or will it always be that multiplier step above the usual conversion factor? So stay tuned. There's a lot more to come, a lot yet to be defined, but it is absolutely clear that Medicare's current intention is to stop paying lump sum incentives after the 2026 payment year that was earned in 2024. What you'll earn in 2025 is an increase in your conversion factor of all payments made in 2026 and beyond.